A big victory this week for 3 local patients affected by the hepatitis C outbreak of 2008, and a huge loss for health insurers. A jury awarded $24 million to patients of endoscopy clinics owned by Dr. Deepak Desai. And as we tape this, an attorney is asking for more, $1 billion in punitive damages. If granted, that would be the largest award in Nevada history. It all began in early 2008 when health investigators traced the infections of the 3 plaintiffs and at least 7 other patients to procedures at endoscopy clinics owned by Dr. Deepak Desai. The outbreak became public when the Southern Nevada Health District notified more than 50,000 people to get tested for blood-borne diseases, including hepatitis C and HIV. During the 2-month-long civil trial, the plaintiff's attorney argued Health Plan of Nevada continued to include Desai in its network of doctors, even though there was evidence Desai was putting patients in danger. The HMO's defense maintained the company never knew about Desai's unsafe practices, and they maintained they were not allowed to present that evidence to the jury.
We feel the jury didn't get all the pertinent facts about one rogue physician in the Valley, many years ago who did a terrible thing, and the jury's not hearing that the criminal course is probably the best one to hear this case.
Because speed and turnover was their big thing, they were reusing vials of propofol, reusing syringes, and caused the largest hepatitis C outbreak in U.S. history.
Dr. Desai is scheduled to face trial on criminal charges, including second-degree murder, later this month. So what's the long-term impact of this verdict on the insurance industry? Joining me to talk about that from Harrison Insurance, Larry Harrison. Thanks so much for being here.
Thank you, Dana. Thank you for having me.
What was your initial reaction when you heard about this verdict?
Health insurance premiums are going up.
So let me ask you, what about the, besides that, but what about the effect on HMOs? Is this going to have, to me it would seem that if I'm an insurance company, I would be very reluctant to tell my patients now which doctors to go to because of this. Is that going to have any impact?
It could very well, but keep in mind, I'm a broker and I work for my clients. I don't work for an insurance company, so I'm here representing my clients, which don't typically have a human resource person. But
these are business people who are
small business owners, correct, individuals, correct. So, my definition of health maintenance organizations, they call them managed care. My definition of managed care is managed costs. So they're always trying to keep costs down with best practices and trying to get efficiency to maintain quality of care, disease management. This is what HMOs are really about.
Robert Eglet, the attorney in this case, he said this is exactly what's wrong with insurance companies. They put profits ahead of patient safety. Do you think this is going to change anything about the way that HMOs choose the doctors that they contract with?
I think they always have considered whether doctors are over-prescribing, over-medicating. This is a big cost driver to the cost of health insurance, is if a doctor is performing too many procedures, prescribing too many medications. That is a problem. So they always are monitoring that.
A lot of people are saying the defendant should have been the state medical regulators rather than the HMO in this case. What do you think of that? Does it really fall on regulators to ensure that
Absolutely.
Safe practices are being maintained?
The insurance companies have to rely on the governing bodies that are established that go into these facilities to maintain or make sure that the doctors are performing best practices. So if they're performing fast isn't necessarily better. Better is better. And this is what the state agencies are supposed to be doing. The insurance companies rely on them. Myself as a broker, I rely on the insurance companies to put the doctors into their networks that are performing best practices.
Care to make a prediction on the punitive damages, just for the heck of it?
I'm not a gambling man.
All right. Mr. Harrison, thanks for being here.
Thank you.